Hi, this is Frank with a frank opinion. Our country is in a very bad place, as all of you know. What we have to look forward to on November 3rd is either electing the most worthless person that we could have ever had as president, the most dangerous one, and have a fast death, or elect a deeply flawed candidate presently in the form of Joe Biden. Lots and lots of people, analysts, citizens, have a feeling that Joe Biden cannot beat the worthless person in the White House without endorsing a full enactment and implementation of Medicare for all. I happen to be one of those. But Joe Biden recently has said that he would veto a Medicare for all bill if it came before him. What do we have going for us as a Medicare for all movement? Because I think there's a different approach. One that I've been trying to articulate in the last few videos. There are about 170 national, state, and local organizations that endorse Medicare for all in the form of H.R. 1384 on the House side. Now look at these, I've just put some. National Nurses United, 150,000 members. Amalgamated Transit Union, 200,000 members. American Postal Workers, 330,000. International Alliance of Theatrical and Stage Employees, 150. International Association of Machinists and Aerospace Engineers, 340K. American Federation of Teachers, 1.7 million. The American Federation of Government Employees, 700,000. United Mine Workers, 80,000. National Educators Association, 3.2 million. United Auto Workers, 400,000. SEIU, 2 million. And 1.4 million Presbyterian Church USA, and 825,000 the United Church of Christ Ministries. That adds up to 11,775,000. And I have a list here of more than 150 additional organizations that belong to the Medicare for All movement, either as a single purpose organization or one that has endorsed. 12 million. I firmly believe that the road to any progressive goal is through Medicare for all. Whether it be raising the minimum wage, overturning Citizens United, gun safety, it doesn't matter. I believe that Medicare for all, if we can achieve that as quickly as possible, it will lead the way to others. It will give us the confidence as citizens to take on the corporate and wealthy elite that Bernie Sanders and others have been talking about for ages. There are 255 registered voters in the United States. Of those, 75 million are registered Democrats. 43 million of the independent voters, which makes up 40% of the electorate, lean Democrat. That's 114 million Democrats or independents that lead Democrat. That's 12 million to 25 million Medicare for all memberships and organizations that have formally endorsed Medicare for all. Over 114 million people that could be coming on board to this movement. That equals 10% to 22% of the population of the United States. That's we the people. That's citizens that are for Medicare for all. The last polls indicated that 80% of Americans favor a Medicare for all single-payer system. And we have the additional amazing organizational work that has been done. But what's the problem? It's fragmented. They don't work together. There's no unifying force. There's no organizational structure that brings them together so that I can, with focus and a relentless way, achieve Medicare for all. So as I've indicated in my previous videos, I see a way forward. For Bernie Sanders, I indicated that his work is not done. I still believe that he has to endow a national Medicare for all institutions. Not lead it, not even be emeritus, but use his remaining campaign funds or part thereof to underwrite the process and the establishment of a national institution devoted exclusively to achieving Medicare for all. And then Bernie has to let go. He's a historic figure. There's no question about it. I love the man myself and have written. My daughter, at the age of 13, gave him her resounding endorsement. She said, I have to do this. But he's got to let go, like any parent. The goal of a parent is to see that their child goes on with some capacity, some self-confidence to make it on their own in the world. He's got to let go. Or else we the people will not be able to take on the powers that be, believe me, that are poised to take us down. Because right now we're fragmented. We cannot simply rely on Bernie Sanders to carry us over the goalposts. And then, as I've indicated before, there's got to be a meeting with Joe Biden, and it should happen sooner rather than later. The Medicare for All organizations have to self-select their team. It can't be Nancy Pelosi. It can't be the DNC and Tom Paris. It can't be the Clintons. It can't be anybody that's involved in that type of political framework to choose the members of the Medicare for All team that would meet with Joe Biden. It's got to be a private meeting. It's got to be a meeting that, and I have done these, by the way. At high levels of government, I have run meetings like this. You do not want press. You want to have people be able to talk to each other in a way that they don't feel encumbered by what they say, where they don't have to feel that they have to perform for the camera. No, the issue at hand is the health care as a right for the American people. Thirdly, no other elected officials in the room. None. When I was with the governor's office, Mario Cuomo, we had lots of meetings, immigration people, health people, etc., exclusively meeting with him. Only people in the room were staff. That's what I'm suggesting here. No other elected official. They will eat up the oxygen in the room. After the meeting, the results can be announced. And the Medicare for All movement wants the results announced. Either Joe Biden, on hearing irrefutable data and information that says that Medicare for All single payer is the way to go, and rejects it, still, that's an announcement, probably one that he wouldn't want to make. There could be an announcement that says Joe and his staff need time, not a whole lot of time. There's been 50 years of research on this. Needs time to digest and are supposed to come back to the Medicare for All team within a specific time frame. And it should be relative to the national presidential election. We need somebody to step up to the plate. The name that comes to my mind, and it's just one, just offering out there, is Roseanne DeMoro, former executive director of National Nurses United, which has been one of the main leaders in terms of Medicare for All. She is retired from NNU, and therefore, as a person that can coalesce others because of her history with Medicare for All, because of her stature, not a bad choice. You may have another, but somebody's got to step up to the plate. What must be avoided at all costs? There is nothing worse, the poison, the hemlock that ruins progressive movements are self-serving egos. People have to be committed to working with each other, laser focus on health care as a right for all Americans. Lastly, borrowing something from the French, one for all for one. That happens to be their motto for their health system. As I indicated before, I think Medicare for all is the road that leads to other progressive goals. So here I have it in the middle. Could be Green New Deal, could be free public higher education, immigration reform plan, paid family leave, many others. If we win on this one, others become possible. And what does that lead to? A future to believe in. Don't you want that for yourself, your children, your grandchildren? Thanks.